So let's come back to our main subject, the origin of European health coverage. The first compulsory health insurance was adopted in Germany by law in 1883. So that makes it now 140 years that Germans are used to having a compulsory health insurance. It started very small. It was only for workers and domestics, so people who are in dependent work contracts and earning very little money under a certain threshold. They had to be insured. So the Chancellor Otto Bismarck, who was a very conservative man, made a series of laws on social security between 1881 and 89. So it took just 8 years. And it covered sort of a package. There was a law on work hazard. So if you have a professional illness or work accident, you were insured. This was on the responsibility of your employers. They had to pay the premiums and to control the institution and control the factories and so on. You had an insurance for health. You had salary substitutes for unemployment, so an insurance for unemployment, invalidity, and old age pensions. So that makes you unemployment, invalidity, old age pension, health insurance, and work hazards, 5 different social security schemes, which were compulsory for these people who earned less than a certain threshold. Now, you can imagine that the generalization of the system, which today is universal, all these insurances cover today all the residents in Germany, it was just achieved by making the wage limit progressively higher and higher and integrate new professions. For instance, independent people were not insured in the beginning, more like lawyers and doctors, but they joined later in between the war period, or peasants were not insured, they were insured later. So it sort of extended, but on the same basis. On professional basis, what was voluntary before became compulsory, and then the level of income of people was sort of higher, and finally the whole population was insured. It took about 50, 60 years to take everybody in. That was achieved finally in the 50s. So, as I already said, entitled were at the beginning, in those days when it started, compulsory enrollment, all workers earning below a certain threshold. That was the beginning. Now, what was the strategy of Chancellor Bismarck? He had a very precise political idea behind. It was not just being nice to people, because he was very conservative. His idea was industry can only develop if the working class is integrated in what Bismarck considered his conservative political regime, the Kaiserreich. We had an emperor in those days in Germany. So now, why did he have this industry? Well, he looked at Britain. England was very highly industrialized, urbanized, and a world power with colonies. And Germany was still very rural, very traditional, and he wanted to bring Germany to the level of Great Britain. In a way, make Germany as big as Britain. So catch up with the British Empire, colonies and big industry. And for that, he needed the working class. And he didn't need a socialist revolution for that. He wanted the working class working, integrated into his system. So he thought, if he gave to the working class a sort of social security for the days they couldn't work because too old or too ill, they would be sort of peaceful workers. And I think his analysis was right. Finally, Bismarck created the biggest and best social institution we needed to make the industrial society live. And it's only now, today, with the changes of technology and the changes of the labor market, that this model is a little bit in difficulties. So what this traditional man did, a nationalist, he was in fact from an Eastern German family who were huge landowners. And this group of people, they used to staff the administration and the military jobs, the army. So this is his background, an army man, a big administrator and a landowner who produced the most modern institution for the industrial world and the workers. So Bismarck would be very astonished if he could see today what his social security laws produced in the world, worldwide. So, and all this was because he had this political goal to catch up with Britain, to make a big industrial empire and prevent a socialist revolution. Because look, here is the lifetime of Karl Marx. He died the very year, Marx died the very year when Bismarck made this law, the first law on the health insurance. And Engels lived in those days. And in Germany, the working class was already organized in trade unions, and the left was organized. They had deputies in different decentralized assemblies and also in the National Assembly. So there could have been a socialist revolution in Germany in those days. And in order to prevent this, Bismarck took, in fact, parts of the socialist program and transformed it into his social security laws. And that was really a historical event, which, you know, changed the world, so to say, made our today's world possible. Now, what I already said is this: the social insurance, which Bismarck put down first for the very poor workers, became a universal sort of institution. And it prepared the social market economy, which made the richest of Germany after the Second World War. The social market economy means a free market, but with social security. So that was a term, a concept that was forged, that was invented in the 50s, 60s, and 70s in the golden 30 years. Now I go back to a little bit to the history of Bismarck. How did he organize these social security systems in a time when investment was going to industry and capitalism was still very, very sort of capitalist? There were no public subsidies. He was not going to give public money to the workers. Every scheme had to be self-supporting. So he organized it according to who was managing, or those who were paying, the contributions were managing. So for work hazard, that insurance, work accidents and so were the sole responsibility of employers. They paid the funding without money from the workers. They managed and they controlled, not always very honestly. For health, retirement, invalidity, and unemployment, there were shared contributions between employers and employees, and their shared management. So the health insurance, let's start with retirement. Retirement in those days was 50-50. The employers would pay 50% of the contributions and the workers as well. So in the council, which would manage the institution, managing this money, there would be 50% of representatives of employers and 50% of trade unions. For health in those days, because it was for the people, not for the employers, in the beginning, the share was 80% of the contributions were to be paid by the people, by the insured people, by the workers, and 20% by the employers. And the result was 80% of the seats in the management boards of these new health insurance funds were workers and trade unionists, and 20% were from employers. So you can consider this as a very conservative thing, because those who profit from the system should pay for it. But you could also think it was very democratic, because they managed according to what they paid in. The result, in any case, the historical result, was a huge learning process for the German left. And I think we still have in Germany today the positive long-term effects of this, because trade unions and workers had to run the funds. They had to manage them. They had to negotiate for instance, with the doctors, which was surely not easy for workers. They had to invest the money for the pension funds, and correctly that workers would get their pension 30 years later. So they had to learn management. And I think that was really an experience, a historical experience, which was quite unique to Germany. But it was then imitated all over Europe and also in the rest of the world. By 1920, historians had worked out that about 2,000 trade unionists were sitting in social security boards. Do you imagine 200,000 workers, trade unionists, sitting in these management boards? This is, you know, a lot, and they learned. So this was the sort of the founding innovation, which the result today is we have a decent health insurances in many countries. So in the early 20th century, and especially the interwar period, these social insurances were adapted throughout Europe and then in South America and in Asia, in Russia too. And latecomers, those countries who were very late, they came after the Second World War in. So it doesn't mean the whole world is covered. I mean, you know it from India, but there are types of insurances like this more or less in every country. So this is how a conservative political problem became the most modern institution of the last 140 or 50 years. Today, many member states of the European Union have written down in their constitution the right to health for all citizens. That's the case in France, in Germany. I don't know for all the countries, but it's quite common to have in our European constitutions written something about the right to health for everyone. It is an important element in democracy, because if you try to cut back health expenditure, generally voters won't vote for you. So it's not a good idea. If you want to be elected, you have to protect the healthcare system in Europe. Just a little example. You all know Madame Thatcher, who governed in Britain in the 80s and was a promoter of neoliberalism. Well, she fought against taxes, against public services, against the trade unions, and she tried to fight against the National Health Service, which she considered was badly managed and should be somehow privatized. But the only thing that she did not succeed in doing was cutting down the National Health Service. The National Health Service resisted Thatcherism. In France, we had a very completely different example, the contaminated blood scandal, when the AIDS virus entered the blood transfusion system. That shocked French people so much, there was a total passionate uprising collectively with lawsuits, and prison high officials were condemned to several years of prison, highly classified scientific people and state officials. There was an outcry against what was experienced like having cheated the people, that the blood transfusion, which was so highly honored in France, could be poisoned. So the outcome in France of this scandal was a huge work on safety of medical care, the surveillance of all sorts of instruments you use and the blood you use, tracing systems. All this didn't exist before the scandal. You can trace back now every physical, any element of blood or organ or skin or whatever you use in medicine, from the donor up to the receiver, and with double checks all the time. So and patients' rights were upgraded. Patients have a lot of rights now, which I didn't have before, because people were so shocked about what happened to the blood transfusion system. And today, patients' organizations in Germany, in France, and I think it's the same in other countries, are policy partners. Every hospital has to have now representatives of the users. All the decentralized administrations who have to do with health have patients' organizations or user organizations in their networks, and also on the national level. Of course, it doesn't mean that everything patients would like to have is taken as it is, but it doesn't mean they are the most powerful representatives in these negotiations and in these councils and commissions, but they are there and they make the voice of patients heard. So this is the development of the last 20 years.